Greetings to everyone. Although there are many videos discussing knee pain, let's talk about what knee pain really means. It can be said that knee pain is a significant threat specifically for the elderly. If you ask how they were before experiencing knee pain and whether the problem can be completely resolved after it arises, the answer is that it cannot be fully cured. The reason is that knee pain is something that elderly individuals are familiar with, and it arises due to joint degeneration. Therefore, there is no definitive solution for this knee pain. In the initial stages, BHRB medical methods and physiotherapy techniques are on one side, while joint degeneration is something that can be avoided. If you ask whether it temporarily alleviates knee pain, the answer is yes, but the joint degeneration continues to progress. Just like when we drive a car, we notice it after covering 11,000 kilometers. Similarly, the need for treatment remains as the degeneration continues. As one ages, joint degeneration becomes an unavoidable issue. What is the difference? Some people may be very thin and fit, and they may have good physical fitness. We worked hard during that time, and due to various reasons, even those who are 70 or 50 years old may not have knee pain. It is important to consider that some individuals may have good knee health at their age. When treating a torn joint, I was surprised to see that in the wild, there are 20-year-olds and 30-year-olds, and their joints look like those of an 8. This joint degeneration is a significant threat to the elderly. The reason for this is that we cannot achieve a permanent solution. When a patient comes in, they often say they have knee pain. An X-ray reveals the condition of the knee. It is in the initial stage. They say to get an injection for it. They have done that to some extent, and they are doing relatively well. However, after a year, they experience increased degeneration. I came across a discussion recently. When looking back at last year, you can see that knee pain was present, and they had taken measures to address it. The degeneration is currently at a certain stage, and as the years pass, the knee joint degeneration progresses to a more advanced stage, potentially doubling or tripling in severity. It transitions from stage 1 to stage 3. So, if you look for a permanent solution, when it changes to stage 3, the only option is joint replacement surgery. Is there a solution for me? Why is there a joint replacement solution? What does solution mean? If you look at it, a solution is something that resolves the issue. It would be a permanent solution. If that is done, there would be no problems for 20 years or even 30 years. Doctors were afraid to perform the operation. Now we hear that there are no problems at all. No need for an operation. Doctor, I beg you, please kindly just give me the injection. Let's talk about the patients. We cannot mislead the patients. We give importance to their opinions to provide them with solutions. If you watch this video, what is the complete solution for joint degeneration? You will find detailed information on how you can achieve that solution. 100%. Let's go ahead and take a look. Now, if you come and see the joint degeneration in the knee, I've mentioned it. When taking an X-ray, we can identify the stages. Stage 1, Stage 2, Stage 3, and Stage 4. The X-ray will show a clear indication of the condition of the knee. After undergoing the medical test recommended by the doctor and taking the X-ray, if you see that the cartilage is in good condition, it indicates that there is some alignment issue in the knee, which could be Stage 1 or Stage 2. If it is said to be in the media, then it has progressed to Stage 2, meaning the joint has deteriorated. If it has developed to Stage 3, then the thigh bone and leg have shifted upwards. If we say translation, then it is at Stage 4. So in this first state of keeping, when the access is good, it works well in the hospital. Today, they are doing treatment. Now, we will solve the current problem. When we look back after 2 more years, you will be at Stage 2, and this time it will work. It definitely won't be available. The situation then was different. The situation now is different. So the solution for this is joint replacement surgery. There is no surgery that is as frightening as joint replacement surgery. Similarly, there have been many successes. There is no issue. So in this context, the positives outweigh the negatives. If that's the case, then joint replacement surgery is the most commonly performed surgery in the world. When considering the surgeries that people are most afraid of, out of 100 individuals, 90 are going for knee joint replacement. Out of those 90, only 45 actually undergo the procedure. These 45 individuals are the ones who are fearful. However, those who have undergone the surgery are doing well. The 45 individuals continue to be afraid, and as time passes, their condition deteriorates from the second stage to the third stage and eventually to the fourth stage. This makes the joint replacement surgery more complex. They are exaggerating the problem that can be resolved by performing a complex primary simple procedure, and the results are diminishing. It can be said that by delaying that time, they are not just escaping from knee pain. Therefore, what happens is that there is knee pain. You are afraid of the operation after undergoing treatment. So if I ask if you can bear it, the answer is no. You cannot walk, right? That is why there is body weight. Diabetes is prevalent among older individuals, and many people end up with diabetes. Pressure. There will be a problem. This cannot all just happen. It is increasing. So have you seen that these 45 people have undergone knee joint replacement surgery? They have all done it and are in perfect fit. 40% of people are still living in fear. We have put out so many videos to alleviate this fear. Despite all the technologies changing, the fear still persists. On one side, this video is aimed at removing that fear regarding joint replacement surgery. If you ensure that you will be well for at least 20 years, there is no need to take medication for 20 years. If you think you need to take pain medication, do you think it will affect your kidneys? For those who have undergone joint replacement surgery, it is essential to take a lot of medication. There is no need to take anything for pain. After the surgery, the pain will significantly reduce within a week, and it will completely diminish in about a month, allowing you to be normal without taking any medication. You are doing well. You have been walking. Don't worry. Everything will be fine with diabetes, pressure, and all that. There is a 95% success rate in this. The doctor says there is a 95% success rate. So what do the remaining scientific studies say? That's why we have knee joint replacement surgery. Currently, we have joints that have been functioning well for 25 years, despite all the efforts made. However, when it comes to some individuals, if they had not undergone joint replacement surgery, they would not be able to walk. Because of the joint replacement surgery, they are able to walk well. However, there is a minor complaint. In cases of light complaints, when the doctor examines, I also feel that the knee is not like it used to be. In this situation, there are indeed small issues. However, if you look at it from a calculated perspective, initially they wouldn't be able to move at all. They would be lying down or sitting, struggling to carry out their daily tasks. They are improving well, and their recovery is quite good. Still, it is not 100% as they expected. It is about 20% less. Are both of these facilities reduced? The patient experiences distraction after total knee replacement, which is about 20% of 50%. When people ask why they came, they say that only 20% of those undergoing knee joint replacement surgery feel any benefit, and they express that they are not particularly happy about it. When scientific studies consider this, the technological changes that have come about and the changes in the medical field are two significant transformations. One is navigation, and the other is robotic navigation. Now, just like we use Google Maps, if we want to go to a place, someone has to go and ask for directions. But with navigation available, Google Maps can immediately guide you to take the right route. This is just a glimpse of the higher advancements that can occur in the medical field. So, just like Google Maps, the change has come in navigation technologies. This navigation technology has been used for many years and has provided great benefits. In some unusual situations where joint replacement surgery cannot be performed, it is only with the presence of navigation technology that the surgery can be carried out effectively. In such cases, it is very useful, and people have greatly benefited from this navigation technology on many occasions. If updated robotic technology is being introduced, it should enhance people's health and alleviate pain. Only then can that technology be considered to have reached its maximum potential, as many videos have told me. So, what benefits does this robotic technology offer you? Why should you choose robotic surgery for joint replacement surgery? What advantages does it have over normal surgery? And what significant differences exist between robotic technology and traditional surgery? When considering joint replacement surgery as the next era, let's first look at a normal joint replacement surgery. What is the difference between a normal one and a knee replacement? The bent knee needs to be corrected. So instead of saying that a joint is being replaced, one might say that the joint is being recapped. The preferred term seems to be that the joint is being modified. Everyone cuts the joint and then attaches a different joint. They think of it like getting an artificial leg. However, when the joint bends and stretches, the bones of the knee and the leg rub against each other, right? That rubbing area can develop wear and tear. This damage creates a pathway for further deterioration. So, in that future, his leg on the TV will be shown as rounded and will have a light in between. This is what joint replacement surgery is about. So this explains joint replacement surgery. One can say that the joint undergoes reconstruction and can be referred to as a resurveying rather than just replacement. When it comes to the replacement, it can be said that it involves both the knee and the joint. It's not about cutting. They only correct the issue with the knee joint and then smooth out the area around it in one go. This way the leg will bend nicely. This is how you come here for the replacement. When doing it normally, a joint comes in and that area is cleaned thoroughly, and then the size is measured to see what size is needed afterward. The conversion technique in robotic technology is done before taking it out. What size is required? How should it be to ensure that the inside and outside are balanced and straight without any bumps or dips? What I am being told is that this should be decided before cleaning the bones, so this is what I want. If I need to compare this to something, it's like building a house. When constructing the house, after finishing it, one might think that it would be nice to have a little room here, but after that it cannot be ordered. But if we take a look at an animation, with the latest technology, we can see a video of a house being built, and we can observe it from above. Do you think it would be better to be in this location? After that, we don't have to build. We can alter this before we start building. This is the realistic truth about the difference between a normal joint replacement surgery and robotic technology. In a normal operation, if you look at it, there are also joints involved. For joint replacement surgery, a small hole is made, and that is how we proceed today. Through this hole, a small incision is made, which can lead to two potential issues. The hole starts from the bone and can cause internal bleeding. This bleeding is not present with robotic technology, so as a result, the blood loss is significantly reduced. Therefore, blood loss is minimized with robotic technology. There won't be any issues. The second significant complication that can arise from joint replacement surgery is a rare and astonishing problem caused by the placement of the holes. This can lead to breathing difficulties and trouble exhaling. Such issues reduce the chances of undergoing normal joint replacement surgery. The likelihood is even lower compared to that. Robotic surgery is significantly better than conventional joint replacement methods. When comparing these approaches, it is evident that robotic surgery offers better outcomes without the need for drilling into the bone. The third important point is that we work with slightly open small instruments. However, larger instruments are used in the eye. Therefore, it is done on a larger scale. When done on a larger scale, there is a bigger injury and more pain. These side effects occur with normal joint replacement surgery. It is said that avoiding normal joint replacement surgery is better, but normal joint replacement surgeries are indeed superior. There is a 95% success rate for surgeries. Have you noticed this 5%? This is beyond the human perspective. When technology works in conjunction with the human brain, it operates as connected hands, achieving 100% effectiveness. That 100% effectiveness, which is supposed to provide benefits, can also lead to severe pain, bleeding, and difficulty in breathing. The robot is ready for the operation. The risk is very low. If you consider all of this, it is definitely robotic surgery that will provide the best treatment. If you ask what is more important, it is that you keep the knee straight. It feels good. It feels good. It's good to stretch and move around. However, when it comes to stretching, there is a range to consider. Have you seen that they say 0 degrees? It sets the time at 0 degrees. Normally, we cannot measure the condition in joint replacement surgery. This is where robotics has made significant advancements, allowing movement from 0 to 90 degrees and even up to 100 degrees. Is it even on both sides? When looking at the knee, both the inner and outer sides should have balance. This balance is important. Let's talk about full range of motion. This means stretching and bending the knee in a full range of movement for balance. We call for the first time every day. The reason for bending the knee while sitting and resisting the urge to get up is that when we sit like this, it is only when we bend the knee and extend it that everything is aligned properly. If the joints are not clean, we may experience pain on one side, similar to how it feels when we are walking. There is a sound like thud thud when we walk, and it feels like something is moving in the leg. So these issues arise in normal surgery. It is somewhat less. There is very little robotics in this video, and it is not meant to say that robotic surgery is the best. Normally, joint replacement surgery has a 95% success rate, but the main point of this video is that robotic surgery offers nearly 100% effectiveness compared to that 95%. This is about robotics. This should not be as we say. It is scientifically based and supported by numerous scientific studies. The current technology is updated in a way that we can think about how it benefits us. Therefore, when a technology develops, there are both positives and negatives. When the negatives decrease and the positives increase, we should accept it. So, this is a comparison of all medical scientific studies to determine what is robotic surgery in this context. For any doubts regarding joint replacement surgery, please feel free to contact us without hesitation. If you think the detailed video is wasting your time, I apologize. Thank you and best regards.